Assalamu alaikum dear students, welcome to Dr. Rumi Lectures. Today we are going to discuss past UQs from ANS Physiology. Our very first question is, what are the neurotransmitters released from preganglionic and postganglionic sympathetic nerve fibers? As you know, in autonomic nervous system, there are two efferent nerve fibers in series. The first one is called as preganglionic nerve fiber and the other one is called as postganglionic nerve fiber. All the preganglionic sympathetic nerve fibers release acetylcholine neurotransmitter. And also in case of preganglionic parasympathetic fibers, once again the neurotransmitter released is acetylcholine. Postganglionic sympathetic nerve fibers predominantly release norepinephrine as neurotransmitters. There are some exceptions. Those postganglionic sympathetic nerve fibers which supply sweat glands, piloerector muscles, they release acetylcholine. And postganglionic sympathetic fibers which supply renal vascular smooth muscles release dopamine as a neurotransmitter. What is the neurotransmitter released from the postganglionic parasympathetic nerve fibers? This is acetylcholine. Next question is, list various types of cholinergic receptors. Cholinergic receptors are the receptors for acetylcholine. There are two types, muscarinic receptors, which are further subdivided into M1, M2 and M3 types, and nicotinic receptors, which are subdivided into NN and NM. The NN receptors are present in the ganglia and NM receptors are present at the motor end plate of the skeletal muscle fibers. By the way, what is the mechanism of action of muscarinic receptors? M1 and M3 receptors, they act by GQ mechanism. We have already studied second messenger pathways. GQ mechanism is actually cell membrane phospholipid mechanism in which diacylglycerol, inositol triphosphate and calcium act as second messengers. M2 receptors act by GI mechanism. It means it decreases the formation of cyclic AMP. And nicotinic receptors open sodium and potassium channels when they are stimulated. Next question is, compare the effects of sympathetic and parasympathetic stimulation on eyes, heart, gastrointestinal tract, male sexual organs, lungs and urinary bladder. These are the most important organs on which you must know the effects of sympathetic and parasympathetic stimulation. So first, the effects on eyes. In eyes, sympathetic stimulation causes mydriasis or dilation of pupil. When dilated pupillary muscle contracts, it increases the diameter of pupil. And parasympathetic stimulation constricts the pupil by constricting constrictor pupillae muscle. Parasympathetic nerve fibers also cause constriction of ciliary muscle, which decreases the tension on zonal ligaments and that makes our lens more globular, that is thicker, and that increases the power of our lens, which is required for accommodation or near response. Sympathetic stimulation increases the heart rate, force of contraction, it increases the signal transmission in the cardiac conduction system, and it also increases the excitability of heart. And these effects are through beta 1 receptors. Parasympathetic stimulation decreases heart rate, decreases force of contraction, decreases excitability, and decreases the signal transmission through the cardiac conduction system, and these effects are through M2 receptors. Sympathetic stimulation, when acts on GIT, it decreases the peristalsis and tone of the wall of GIT, but it increases the tone of sphincters. So it decreases the forward movement of the intestinal contents. Parasympathetic stimulation increases the peristalsis and tone of the wall of gastrointestinal tract, but it relaxes the sphincter. So parasympathetic stimulation increases the forward movement of the intestinal content. So, and this is responsible for defecation to occur. In case of male reproductive organs, parasympathetic stimulation is responsible for causing erection of penis and sympathetic stimulation causes ejaculation. In case of lungs, sympathetic stimulation causes dilation of bronchioles and parasympathetic causes constriction of bronchioles. Sympathetic causes constriction of blood vessels and that decreases the secretion in our lungs. So sympathetic stimulation makes it easier for us to breathe. And parasympathetic stimulation dilates the blood vessel, which increases secretions and it becomes difficult to breathe. Sympathetic stimulation causes relaxation of the body of bladder or detrusor muscle, and it causes constriction of the internal urinary sphincter and the trigone of bladder. So sympathetic stimulation, which is during emergency, for example, when we are running, we are doing exercise, at that time urination is decreased or it is prevented. But parasympathetic stimulation causes contraction of the body of urinary bladder, that means detrusor muscle, and it relaxes the trigone and the internal urinary sphincter. So it causes the urine to pass out or urination to occur. It means we can say that defecation and urination both are parasympathetic reflexes. So when we are in emergency state, defecation and urination both are prevented because during emergencies, sympathetic system is more activated. Next question is state the functions of alpha and beta adrenergic receptors. Because epinephrine is also called as adrenaline and norepinephrine is also called as noradrenaline, so their receptors are also called as adrenergic receptors, which are alpha and beta. Alpha receptors, there are two types, alpha 1 and alpha 2, but alpha 1 are more important, and beta receptors, they are two important types, although there are more, but two more important types, beta 1 and beta 2 receptors. So some of the adrenergic functions are through alpha 1 receptors and some are through the stimulation of beta 1 and beta 2 receptors. Alpha 1 receptors are present in the blood vessels of viscera. So whenever there is emergency, the blood supply to the viscera like kidneys and intestines is decreased so that there is less urine formation and also less digestive activity. In the iris of our eye, there is contraction of the dilated pupillae muscle which opens our pupil so that we can see more light at the time when there is emergency. For example, if someone has to run, he needs to see better. So that's why pupil should dilate and it will make him see more light. Alpha 1 receptors cause relaxation of the wall of GIT and cause constriction of the intestinal sphincters. So in this way, the forward movement of intestinal content, for example, defecation, is inhibited. Alpha 1 receptors also cause contraction of bladder sphincters, so urination is inhibited. Beta 1 receptors are present in our heart, which when stimulated increase our heart rate and also increase the force of contraction. So by increasing the force of contraction, stroke volume is increased and cardiac output will increase because the formula of cardiac output is equal to stroke volume into heart rate. So both heart rate and stroke volume as they increase, hence cardiac output will also increase when beta 1 receptors are stimulated. Beta 2 receptors are present in the blood vessels of skeletal muscles. So when we are doing exercise, the blood vessels of skeletal muscles must dilate. This is through beta 2 receptors so that they get more blood supply to get more nutrients and more oxygen during exercise. Beta 2 receptors also cause relaxation of the intestine. So in this way, intestinal activity will be decreased. Uterus relaxation so that the uterus contractions will be decreased. Bronchodilation so that the bronchioles dilate and there is more entry of air during stressful situations, for example during exercise. Beta 2 receptors also speed up our metabolism, so calorie genesis will be increased. Beta 2 also relax the wall of urinary bladder, so urination is inhibited. It also increases glycogenolysis to convert glycogen into glucose. So at the time of emergency, our brain needs more glucose. This is provided by breaking down glycogen which is stored in our liver. Beta 1 receptors increase lipolysis so that triglycerides break into fatty acids and those fatty acids will be used by the muscles as a source of energy. So during states of emergency like exercise, the favorite fuel for our muscles is lipids. So we increase lipolysis so that more fats will be used by muscles as a source of energy and glucose level in our blood will be increased so that more glucose can be provided to our brain, and this is done by glycogenolysis by breaking the glycogen which is stored in our liver. So glycogenolysis is through beta 2 receptors and lipolysis is through beta 1 receptor. Next question is enumerate 12 effects of sympathetic stimulation in the body. Although we have already discussed effects of sympathetic and parasympathetic stimulation on some important organs of the body, but just to reiterate, the effects of sympathetic stimulation on heart are to increase heart rate, increase contractility, increase speed of conduction through the cardiac conduction system, and increase excitability through beta 1 receptors. Alpha 1 receptors in the visceral blood vessels, like in the blood vessels of kidney and the splanchnic circulation, which supplies our GIT, causes constriction of the smooth muscles, hence decreasing blood flow to the kidney and decreasing blood flow to the intestine. So less urine formation and less digestive activity. The vascular smooth muscles in our skeletal muscles dilate through beta 2 receptors and that increases blood flow to the skeletal muscle during exercise. Beta 2 receptors dilate bronchioles which increase the air entry during emergencies. Alpha 1 receptors are responsible for causing ejaculation in males. Beta 2 receptors relax the wall of urinary bladder or body of the bladder, and alpha 1 receptor constrict the sphincter, hence urination will be inhibited. There is an increase in sweating, and this is through muscarinic receptors because sweat glands are supplied by sympathetic postganglionic cholinergic fibers. There is increase in renin production, this is through beta 1 receptors, and there is increase in lipolysis, this is through beta 1 receptors. There is increase in glycogenolysis and increase in calorie genesis, this is through beta 2 receptors. Increased sympathetic stimulation also increases mental activity, it increases the rate of blood coagulation in case if injury occurs during fight or flight reaction. Sympathetic stimulation through alpha 1 receptors also causes mydriasis, which means dilation of pupil. Next question is briefly describe the effects of sympathetic stimulation on thoracic and abdominal viscera. Some important thoracic viscera on which you need to mention the effects of sympathetic stimulation are heart and lungs, and abdominal viscera are GIT, liver, kidneys, and bladder. We have already discussed the effects of sympathetic stimulation on heart, lungs, GIT, and urinary bladder. In case of liver, there is glycogenolysis, so glycogen will be broken down to provide glucose. In case of kidneys, there is increase in renin production and there is decreased urine output, so urine formation will be decreased. Next question is what is Horner syndrome? Horner syndrome is because of damage to the sympathetic nerve fibers which start from the superior thoracic segments, synapse at the superior cervical ganglion, and then travel along the larger blood vessels to supply on the same side of face and the eye. This is a long sympathetic pathway which can be damaged because of lung cancer, traumatic injury to the upper part of the chest or neck, surgery in the chest or neck region, or if there is some damage to the large blood vessels which arise from the aorta and supply the same side of face. The features of Horner syndrome are present ipsilaterally or on the same side of damage to the sympathetic nerve fibers, and these features are meiosis, which means constriction of pupil. Because sympathetic nerve fibers they cause dilation, so if there is no dilation because of damage to sympathetic fibers, the uninterrupted parasympathetic fibers will cause constriction of the pupil. Because of damage to the sympathetic nerve supply to one of the muscle of the upper eyelid, which is levator palpebralis pluralis, there is drooping of the upper eyelid, which is called as ptosis. Because sympathetic nerve supply normally causes constriction of the blood supply of the face, so when there is no sympathetic signals coming, it causes dilation of the blood vessels, which causes flushing or more blood flow on the same side of the face. Sweating is also a sympathetic mechanism. So lack of sympathetic signals will cause absent sweating or anhidrosis. So this side of the face will be dry. Next question is a thief is being chased by a police officer and is under great stress. Write a note on the alarm reaction or stress response of the sympathetic nervous system. This is also called as fight, fright or flight response, and this is because of journal or mass discharge of the sympathetic nervous system. Stress response prepares the body for vigorous activity which is needed to deal with the life-threatening situation. Because this thief is being chased by the police officer, so he has to run to save his life. So in order to do that, his heart will beat faster, so his heart rate will increase. There is also forceful contraction of heart, so stroke volume will increase. This will increase cardiac output so that the blood pressure increases and the organs, especially the muscles which are important for running, will get more blood supply. More blood supply so that muscles get more oxygen, more nutrients for getting more calories and for strength. There is also increase in blood flow to the muscle because beta 2 receptor cause dilation of the smooth muscle of blood vessels in the skeletal muscles. Also at the same time when someone is running for life, there should be less blood supply to the kidneys and to intestines so that there is less urine formation and less digestive activity. And this is done by constricting the blood vessels which are supplying the kidney and GIT through alpha 1 receptors. Glycogen which is stored in liver is broken down through beta 2 receptors so that more glucose is provided to our brain. So our mental activity will also increase. And the rate of cellular metabolism like glycolysis will increase. This is through beta 2 receptors and this will increase the muscle strength. And also when the thief is running, his pupils dilate, mydriasis, so that he has a better view of the environment so that he can escape. And if when thief is running, if there is some injury, his blood clotting mechanism should also be activated so that bleeding can be stopped. So hemostasis mechanism will be increased. So there is increase in the rate of blood coagulation. Next question is briefly describe sympathetic tone. Sympathetic tone is a basal rate of activity in the sympathetic nervous system. It means even when we are not in In emergency state, our sympathetic activity is not at zero. So there is some partial state of activity even when we are not dealing with emergency situations. That is called as sympathetic tone. So similar tone is also present in the parasympathetic system, that is called as parasympathetic tone. Most of the organs of body are supplied both by sympathetic and parasympathetic system. And this background activity, that is the tone, allows for increase or decrease in the activity of that organ by a single system. As our heart is supplied both by sympathetic nerve fibers as well as by parasympathetic nerve fibers. So we can increase our heart rate by increasing sympathetic tone, or we can decrease heart rate by decreasing sympathetic tone. And also we can increase heart rate by decreasing parasympathetic tone, and we can decrease heart rate by increasing parasympathetic tone. Some organs or systems of the body have predominant sympathetic tone and some have predominant parasympathetic tone. So this is why when we have general stimulation of the autonomic nervous system, for example, when someone smokes, so smoking increases nicotine level in the body, and that stimulates both sympathetic as well as parasympathetic systems. And because blood vessels have predominant sympathetic tone, which when increase will cause vasoconstriction and will increase your blood pressure. And in the same case of smoking, because on GIT there is predominant parasympathetic tone. So smoking, which will increase nicotine in the body, will increase the parasympathetic tone in the GIT wall. That will increase the peristalsis, decrease the tone of the sphincters, and increase the blood supply to the GIT. So in this way, it will increase the movements of GIT and increase the excretory activity. So digestion and absorption will be increased. So tone is a basal rate of activity, a partial state of activity in any of the sympathetic or parasympathetic system. So it means when sympathetic or parasympathetic stimulation is not there, even then there are parasympathetic and sympathetic signals in various organs and viscera. Our last question today is, what is the role of adrenal medulla? Adrenal medulla is actually part of our sympathetic nervous system. Adrenal medulla is embryologically different from the adrenal cortex, and the cells in the adrenal medulla, which are chromaffin cells, actually represent the post-ganglionic sympathetic neurons. But the only difference is that these cells in the adrenal medulla, they do not have axons, and they release their secretions directly into blood capillaries. So the secretions of the adrenal medulla, they are actually hormones, epinephrine and norepinephrine. 80% of that is epinephrine, 20% is norepinephrine. So we can say adrenal medulla is a large sympathetic ganglion, and what is its importance? It supplements the actions of the sympathetic nerve fibers, and because it releases epinephrine, which has relatively longer half-life than norepinephrine, so this is why it will prolong the actions of the sympathetic stimulation whenever there is stress response. So this action of epinephrine can last up to 2 to 4 minutes. Because adrenal medulla is part of your sympathetic nervous system, so this dual mechanism, one is the sympathetic nerves and the other one is adrenal medulla, both of them are releasing norepinephrine. This is a safety factor, which means when one factor is missing, then the other one will be acting as a substitute. And also those structures of our body which are not innervated by the sympathetic nerves, they are stimulated by the epinephrine, norepinephrine, which is released as hormones from the adrenal medulla. For example, after cardiac transplant, there is no sympathetic nerves which are supplying the transplanted heart. So because this heart has beta receptors, this is also stimulated by the epinephrine, norepinephrine, which is coming from the adrenal medulla. Now, very important question. What do you think? Adrenal medulla, is it essential for life or not? You see, adrenal cortex, which releases mineralocorticoid and glucocorticoid, aldosterone and cortisol respectively, that is essential for life. But adrenal medulla, even if it is removed, it is not essential for life. We can survive even without the presence of adrenal medulla. For example, those people who have a tumor of adrenal medulla called as pheochromocytoma, this increases the production of epinephrine, norepinephrine. So that's why it increases their blood pressure. It gives them headache that causes more vasoconstriction and also more sweating and anxiety in their body. We have to remove this tumor by surgery. So even when this tumor is removed from the adrenal medulla, the person can survive because adrenal medulla is not essential for life, because sympathetic nerves are still there which release their norepinephrine, which can perform its sympathetic actions. A very important clinical MCQ, because the half-life of epinephrine, norepinephrine is very short, so that's why it's difficult to measure these catecholamines in our blood and urine. So what do we do in that case? For example, if a person is having pheochromocytoma and if you have to measure some marker chemical, so what will you measure? These catecholamines, epinephrine, norepinephrine, they are converted to metanephrines and vinyl mandelic acid, VMA. So we measure the level of metanephrines and VMA in our blood and urine. So if their level is raised, this indicates that there is more production of epinephrine in our body, and it may be pheochromocytoma. So we have discussed some important UQs from past papers of UHS. In our next session, we will discuss UQs from blood physiology. Thank you so much for watching this video. See you next time with another video.